So the earthquake, 11:59 Australian Eastern Standard Time on Sunday the 26th of December 2004, the Boxing Day tsunami. We used to measure earthquakes on the Richter scale. There's a new scale they use now, but it's roughly the same. So it was 9.1, variously reported 9.1 to 9.4. Earthquakes, of course, escalate by a factor of 10 for each number. So a 9's 10 times worse than an 8 and so on. We had a lot of aftershocks in the 6-7 region and they were bad enough. I can't imagine what a 9 was like. But in Banda Aceh itself, people couldn't stand, they were knocked to the ground, buildings collapsed, and of course 100 kilometres offshore there was a shift in the tectonic plates, an uplifting, and that caused the tsunami. And the tsunami hit Banda Aceh within 15 minutes, so hardly any warning at all because it was so close. And the wave was 30 metres to 34 metres high when it struck the shoreline of Sumatra. Numbers vary, but 230,000 is the official estimate of how many were killed worldwide, and the majority of those, of course, died in Indonesia. In Thailand, where there were 5,000 or 6,000 deaths, a lot of effort to identify people because they were foreigners, and so we spent and sent forensic teams to help. Not so in Indonesia. The numbers of dead were so great that the Indonesians just plonked them in 10-man graves, and bodies were just buried as quickly as they could be found and buried. But of course, 500,000 people displaced, so we had a major humanitarian crisis in needing to provide those people with medical assistance, with food and water, and with shelter. Banda Aceh was semi-destroyed. About a third of it was completely destroyed by the wave. Another third of it was inundated with mud and bodies and wreckage, debris. And then there was a final third that wasn't hit by the wave, but of course was badly affected by the earthquake. The other large town down the coastline, Malabo, was about 50% destroyed by the wave. So, just to situate you, the earthquake occurred, the two stars just off the western coast of Sumatra was the top of those two stars. The other one was the 8.6 earthquake that occurred in end of March, early April. And the countries affected surrounding the Indian Ocean, Sri Lanka, India, Thailand, Malaysia, and of course Indonesia. And most badly affected was Aceh in the northern tip of Sumatra, and the city of Banda Aceh at the north there, and halfway down on the west coast, the city of Malabo. And the wave essentially affected that area of Aceh, and in particular it went in about 2 or 3 kilometres before the higher mountains stopped it. All of the villages, all of the road infrastructure was in that 2 or 3 kilometres and was effectively destroyed. The West Coast Road was completely swept away, ports were destroyed, communication facilities were gone, there was literally no information coming out of the disaster zone at all. As I showed you, unburied dead, so there was an environmental crisis. There was no fresh water. The water pipes in the city of Banda Aceh had been destroyed in the earthquake. Then the wave had come in and salinated what fresh water there was. So for the millions of people and hundreds of thousands of people still in Banda Aceh who survived, there was no water at all, and because there was an impending crisis of disease that could break out, which could really magnify the effects. There was a massive surge of support, particularly from Australia in financial terms and aid terms. There were concerts and charity cricket matches and telephone lines, so lots of aid donated. It was very quick. Obviously it wasn't a great day for a disaster to occur. Boxing Day, most people were on leave. We had a very low level of force preparedness that day, but things ramped up very quickly. There was a strategic command group meeting that afternoon. We immediately warned C-130 capability, a medical capability and a water purification engineer team to deploy. And in fact, the initial response was commanded by Air Commodore Glenn Steed, who was commanding Airlift Group, and Group Captain at the time, Bill Oddie, who some of you might know through his service in Afghanistan subsequently, but Bill took the first C-130 over, and it left on the 27th, loaded with humanitarian aid supplies and a medical support team, a surgical team. Within a couple of days, so as more information arrived and the scale and size of the disaster became clear, the government decided to form a combined joint task force, and that task force would deploy for an undefined period of time to an undefined location with an undefined task, but it would comprise exactly this force structure, and it would be capped at 1,050 people. A random number that I don't know who came up with, but we couldn't have 1,051, we had to have 1,050. So that was the task force. It was a combined task force because we had New Zealand medical team, we had 2 British Bell 212 helicopters that came from Brunei. Of course, we had 6 UH-1H in total, and they were all required. We also had for a little while 2 ships, Knimbler, of course, which was fundamental to the operation, and the Berlin, which was a German hospital ship. Berlin was in, out over the first week as the Germans dithered. The ship was deployed, but the Germans couldn't decide whether they wanted it to be part of an Australian-led task force or to operate independently, and in the end they decided it would operate independently, even though we had a PRC from it located in our hospital unit. So the field hospital had some Germans working there as well. And of course communications and logistics were key parts of the force structure. So initially the operation was called Operation Tsunami Assist, and CDF was of a mind that CJTF 629 would run all operations associated with the tsunami. But pretty quickly that became obvious that we just weren't big enough to do that. So the Americans put their main base in Thailand, in Ubon, and they ran the operation from there, Marine General Blackwood. We were then, and it wasn't as clear cut as this nice triangle indicates, but essentially we were given the Aceh area and Butterworth as our logistic base as our area of operations. Deployable Joint Force Headquarters was still going to be their headquarters deploying. So I had my BMDQ RSM and now General Stuart Smith as my Deputy Commander Chief of Staff with the Deployable Joint Force Headquarters. So obviously I was faced with the challenge of an afternoon briefings in Canberra and then going up to Brisbane, taking over an unfamiliar headquarters, planning an operation for which we had very limited information, almost nothing, very limited guidance and direction, and then deploying. And so I tasked Stuart with just getting us into theatre, and that was the focus of the headquarters work for the first couple of days. Very messy. The deployment was ad hoc, very piecemeal. There wasn't good briefing of people. There wasn't good understanding of what we were going to do when we got there. Anyway, on the 2nd of January, after 2 days of frantic work, I deployed with the headquarters. So 2 things uppermost in my mind. We didn't have very much in the way of guidance from the CJOPS, and we didn't have an op-board, so needed to do a mission analysis and produce an op-board, decide what it is that we were going to be doing. And as part of that, but very pressing, had to decide the force laydown. Force elements were arriving and they needed to be told where to go. So the first thing I did was, as you do, take a C-130J to do a recce, and flew over the mountains from Medan, where the major airport we were using existed, over onto the west coast, up the west coast, flew on to Bandar Aceh and met with General D'Amano. So he was right under the pump in trying to plan the overall operation, and if we had challenges of information, he had much bigger challenges. So I made it clear immediately to him that that we were subordinate to him, that we were there to help, that we would provide the help that he required, and that whatever guidance he could give us would be useful. He was already positively disposed. We'd already had 3 or 4 C-130 flights in delivering assistance, and so we were the first in of this, as I say, second tsunami of helpers and supporters coming in. He made it plain in that meeting that Malabo would have been out anyway, that they were establishing a safe zone in Bandar Aceh, and that we needed to lay down the force inside the safe zone. He also shared with me, although this slide came about later, but the operational plan that he had. And so this was the first that we were advised that the emergency phase, the military phase, would last 3 months. We had to shape our efforts to make sure that we were finished and out by then. But of course the TNI, who did the bulk of the debris clearance work and almost all of the difficult work with bodies, worked like Trojans to hit that target. So we had to do our mission of analysis. The mission that C. Jobs gave me was go and do some good. So, okay, that's pretty broad. Obviously, emergency relief work, saving lives, reducing threats to survivors, establishing the preconditions for reconstruction to commence. Based on that, we came up with a mission which was to go and do some good, and I gave my team the end state for them to plan around. But really, you can read all that, but it doesn't say very much. It just says that within the constraints provided by the Government of Australia, we would go into the AO, which we had to define, and we would do some good, led by or guided by the Government of Indonesia's desire. So all that was said in eventually a very large and impressive B-pass op-ord, which I'll produce. So where to lay the force down, where to put the headquarters, the field hospital, the engineers. Now the field hospital was already deploying from the 2nd of January as well. It finally got into theatre completely on the 5th of January. The rotary wing helicopters flew in Antonovs on the 5th, the 7th and the 11th of January. So force elements were arriving and we had to tell them where to go. But the guidance was clear. Main headquarters had to be in Medan. The forward headquarters could be in Bandar Aceh, and the hospital had to be in the safe zone in Bandar Aceh. There were 3 hospitals in Bandar Aceh. One was a TNI hospital into which we put a surgical team initially, and so they were already working with the TNI in that hospital. One which was completely destroyed, and one which was in the inundation zone and partially destroyed. And it was the Zainal Abidin Hospital in the inundation zone, very large teaching hospital, about 900 staff, 300 of whom were killed. All the geriatrics, the paediatrics wards, the children in there were killed in the tsunami. About 600 people had survived, staff had survived, but none of them were there, and the hospital was knee-deep in mud and bodies. But that's where I decided to put them. So up in Bandar Aceh, Kanimbla, when it arrived on the 15th of January, located. back down in Medan, the CJTF headquarters, and of course in Butterworth, our logistics base, and so we're operating really a triangle there. In Banda Aceh itself, you can see in the top right of the safe zone established by the TNI. We located initially the Anzac Field Hospital in the Zainal Abidin Hospital. General Cosgrove, who was CDF, decided to call it the Anzac Field Hospital. It was 1st Health Battalion, I think, was its real name, but because we had a platoon of 30 Kiwis in it, always General Cosgrove's good at the optics of it and selling the optics, so Anzac Field Hospital. You can also see on this map the Punanyong Bridge, which we called the Bridge of Death, because when we arrived it was clogged completely underneath and covered in bodies. And near there, the convent water point, which isn't marked on the map, but where I established the first water point, sucking water out of the river that goes through Banda Aceh that was full of bodies. The Grand Mosque, which was important, and then the engineer group eventually, when they arrived, located in a technical college which used to teach hospitality, which was also inundated but basically needed just repair and clean up, and so they lodged next to the hospital, which was good for force protection. So early difficulties, we didn't have any maps, so we needed to get our map producing people to start churning out maps. They eventually arrived, and they arrived after most of the operation was done, so that was useful. We had a limited map production capability ourselves with our engineers, and so we produced our own maps initially at least. Medan and Banda Aceh airports probably became the busiest airports in the world for a period of time, and so we had a real problem with connecting available lift capability and aid that was arriving. But within a few days we'd started to sort things out. We were moving refugees, backloading them on C-130s out of the disaster area. We hit about an average of 25 tonnes a day of aid going forward. We got rotary wing capability. Ours didn't arrive in Banda Aceh until the 6th and thereafter, but there were already American helicopters in place, and of course the rotary wing were key to getting aid down from Banda Aceh to the people who needed it on the west coast. But we took over on the 6th of January air traffic control duties, and so 300 to 400 aircraft movements a day, and our air traffic controllers were fabulous. They established some protocols and a system. It was significant because we got rotary wing operating and getting aid down to the west coast. And the only crashes we had were caused by mechanical failure, not by a failure of air traffic control. We'd also established an NGO conference daily. I had a CIMIC team led by CO, 7 CEO, Colonel Maguire, and he very quickly realised that we needed to grip up the NGOs. Every day we'd be able to brief them on what the conditions were, what available assets we had, and they would brief on what they were doing. And then we would link that with an evening conference up at Banda Aceh at the airfield, which was a tasking conference for rotary wing. So essentially we'd already found a battle rhythm, and we were getting our way out of the confusion of the first few days and into actually doing the task. Just to go through the force elements, the C-130s were key. I had 7 C-130s at the start of the operation, but of course we were still operating in Timor. In fact, I'd been in Timor for Christmas Day with VCDF and flew back on Boxing Day visiting Shane Coy, who was commanding whichever battalion he commanded, I can't remember now. Was it 6? Yeah, so they were in Maliana in Timor. We were in the Solomons, and we were also in Iraq, and there was a Special Forces Squadron in Afghanistan. And so competing pressures came to play. For the first few weeks, Sumatra Assist was the most important operation that we were running. But then the challenge for me was to hang on to assets as pressure came on for CJOPS to move assets elsewhere. And so I had to really struggle to keep Canimbla through the operation. I had to really struggle to keep C-130s. And towards the end of January, we were down to one C-130, which Chief Air Force faithfully promised me would be reliable, but of course, as luck would have it, within a few hours of it being the only one left, it broke down for 24 hours. And we were totally dependent logistically on that C-130. Most of the C-130s had been moving aid, but of course our logistic air bridge was created by the C-130s, bringing stores forward for the force. And we didn't have C-17s in those days, so we were using Antonovs, and Antonovs were rated to carry cargo, couldn't carry ADF personnel because they were unsafe. And so they were like cowboys. They'd do a turn on the taxiway, and we had to build a wall of shipping containers to protect our rotary wing from being blown away by them as they just gunned their engines and took off. So the Iroquois were a great helicopter, they were a great helicopter, but they were a great helicopter for disaster relief operations, mostly because the downwash of the rotor blades is fairly soft, unlike the bigger helicopters, Black Hawks and NH-90s and things that we operate now. I had another 6 Black Hawks and 4 Chinooks on standby, but as I said, there were 120 helicopters, 150 helicopters in theatre pretty quickly, so we didn't need to deploy those. We operated with our 4 Australian Iroquois and 2 British Iroquois. And they flew everything down the west coast. There was absolutely no ability to move things by road. The ports were destroyed, so LC8 was the only way to get stores down by sea, so really everything went down by helicopter. The Anzac Field Hospital, as I said, based on one health support battalion and working out of Zainal Abidin Public Hospital with the Germans, the Singaporeans, and eventually Indonesian capacity coming back in and providing surgical care, led by Lieutenant Colonel Georgina Whelan, who now I think is the head of the SES in the ACT. Did a lot of stuff to try and keep people's morale up. One of them was we had babies born in the hospital, 18. One of them was called Anzac, Mohammed Anzac, and so he's about 13 years old now, and I'm sure he regrets his name. The engineers, water purification, debris clearance, drain clearance, turning this sort of thing into that, basis for reconstruction. Most of the work done by hand though, clearing Monty drains, bodies in there. These guys did a power of work in hot weather, with environmental threats, with bodies, with snakes, cobras and crates and things in there. They're the people who produce the actual outcome for a course. To give them a break, we recovered 18 fishing boats that had been washed inland, so field engineer section commanders were given the task to recover a boat. They had to figure it out themselves how they did it. We start off with small boats and we finished off relaunching quite large fishing boats. And Canimbla obviously transported the engineers, but it really provided hotel services. Every 3 days you could go and have a shower and get a hot meal on Canimbla. So we achieved lots of stuff. Obviously reporting metrics were important. Government had to know whether we were making a difference or not, and Stu Smith worked out a big table of measures of effectiveness for us to report against. Okay, we can respond quickly, and that's what had to happen. The militaries have a capability to respond quickly, but mission creep's a real problem, and you have to understand the constraints that government puts in place on your role, not let people, and the natural tendency in a disaster relief operation is for people to want to do more and to want to help more and to go beyond our mandate. We're in an information vacuum, and so we could have been paralysed, not being able to make a decision about anything, but in fact we just had to let assessment teams pull the force and make decisions based on the information we had. Coordination was probably one of the biggest challenges, and as I say, we got through that by having coordination conferences, by letting the Indonesians lead them. And look, the mission stands or falls on junior NCOs, on cultural and sensitivity, on understanding the mission, not just the military mission, but the government's mission. And of course, media, they're a part of any operation. I believe that the commander should be the face of the operation, should be his own spokesman. Not everyone does that. General Cosgrove did it brilliantly. AusAid particularly were brilliant. And so one of the things I did was bring AusAid into our headquarters in AusAid LO, so that decisions I was making, like which hospital we chose, which we did without their guidance, but was a fundamental one. Fortunately, it was the right decision because they took over supporting the Indonesians in the Zonal Aberdeen Hospital when we left. With the engineers, we handed over water purification, which was probably the key to preventing disease. We were the only people producing water for quite a while in Banda Aceh. We handed that over to the Red Cross, and they took over the convent water point. We actually gave the TNI the water purification Oompa Loompa machines. I know took 2 engineers and 3 Raimi blokes to keep them running, and lots and lots of chemicals. The Red Cross set up 2 big corrugated iron tanks, which they threw some flocculant in and called that clean drinking water, and so they had a lot simpler system that was able to be deployed more easily than ours. But in each case, we had worked to make sure that when we left, there was something picking up the slack. We also worked to make sure we weren't creating a false environment, so that we weren't conducting operations that would require high-level surgical support down the track that the existing Indonesian medical system could take over from us.